Good morning, everyone, and thank you for joining us today. My name is Louis St. George, and I'm the public relations manager here at Essentia Health. I know we're all experiencing a little bit of Zoom fatigue these days, so hopefully the next time we're able to come together, we can do so in person. Today, however, we want to discuss what's become a little bit of a dangerous trend as this COVID-19 pandemic continues. Increasingly, health systems like Essentia and St. Luke's are seeing patients delay or skip important medical care, presumably over fears of contracting COVID in one of our facilities. We've had some unfortunate outcomes as a result. And here to talk about this issue this morning are Dr. John Pryor, President of Essentia Health's East Market, Dr. Nick Van Dielen, Interim Co-President, CEO, and Chief Medical Officer at St. Luke's, Dr. Andy Beeland, Emergency Medicine Physician at Essentia Health, and Dr. Gretchen Korstens, a pediatrician at St. Luke's and the medical director for Wilderness Health. We'll start with opening remarks from the four doctors, and then we'll take your questions. For those questions, please raise your hand to be called on or submit them using the Q&A button at the bottom of your screen. And we'll get to as many as time allows, planning to wrap up probably by about 11:40 or 11:45 a.m. at the latest. Without further ado, I'm going to pass it over to Dr. Pryor.
Hi, everyone. I'm Dr. John Pryor, President of Essentia Health's East Market. Thank you for joining us this morning. As we've confronted this COVID-19 pandemic, our local media has repeatedly helped us amplify important community messages. We're asking for similar assistance today. That's because health systems like Essentia and St. Luke's are seeing an alarming trend. Many folks are delaying or skipping needed medical care, presumably over fears of COVID. Neglect of health issues and chronic conditions is a recipe basically for disaster. When COVID was rampant throughout our region in the fall, we were really effective at communicating how dire the situation had become. Our hospitals were full and we were running out of capacity to care for patients. Fortunately, that's no longer the case. At Essentia Health St. Mary's Medical Center, for example, our number of COVID inpatients is down by about 95%. Oftentimes you can count them on one hand. On top of that, virtually all of our providers have been vaccinated and we're still requiring masks and promoting social distancing in our hospitals and clinics. Our facilities are safe and we're ready to treat you. Before I turn it over to Dr. Van Dielen, I want to share a few unsettling statistics that drive home the pitfalls of avoiding preventive care. First of all, the National Cancer Institute expects an additional 10,000 deaths over the next decade from breast and colorectal cancers. That's 10,000 deaths more than normal because those cancers were underdiagnosed and or undertreated. From the Journal of the American Medical Association, also commonly known as JAMA, diagnosis of 6 cancers: breast, colorectal, lung, pancreatic, gastric, and esophageal, dropped an astounding 46% in the United States during the early stages of the pandemic. These cancers just didn't go away. We just weren't diagnosing them. And if you don't diagnose them, you can't treat them. It's been reported, the third one is it's been reported that more than 40% of US adults skipped medical care during the initial months of the pandemic. Fear of COVID exposure was a dominant reason why. And finally, even at Essentia in Duluth, our screening colonoscopies dropped from about 1,100 in 2019 to 750 in 2020. That's a 33% decline in 1 year. Please, please, please seek care if you need it so that your health doesn't deteriorate. Get the follow-up care you need for conditions like diabetes and hypertension. Get your preventive care like colonoscopies and mammography. Finally, I want to thank our community, you, for all the sacrifices you've made, especially over the past few months, which helped us navigate that dangerous surge. We're almost through this pandemic, which leads to my last point. Please, when your turn comes, get the vaccine. So, in summary, stay healthy, which means wear a mask and see us for your care. Thank you.
Thanks, Dr. Pryor. Dr. Van Dielen.
Thanks, Dr. Pryor. I want to echo what Dr. Pryor said and ask everyone not to delay their care. Whether it's an urgent need or annual screening, it's important to your health and well-being that you get the care you need. We want to see you. It's important for us to help keep you healthy. If you're experiencing serious problems like shortness of breath, chest pain, or other heart-related issues, you need to seek care immediately. According to a recent report from the American Heart Association, illnesses like heart disease, stroke, and diabetes have caused more deaths during the pandemic because people have simply waited too long to receive care. These conditions can be prevented with regular screenings. You may not be as healthy as you feel. Don't put off necessary care and wait to be seen once the pandemic's over. Your health could be in serious jeopardy, and it could create a snowball effect as others are trying to be seen at the same time. This puts everybody at risk. Another thing to consider is the impact on your finances. Delaying care can lead to far more serious conditions, which means a bigger dent in your wallet. If you're worried about COVID-19, don't be. We've figured out how to keep you safe. It's our job and it's our passion to keep you healthy. We are diligently following infection control measures that have been put forth by the Centers for Disease Control. That includes, and you've heard this multiple times, practicing good social distancing, disinfecting patient rooms, clipboards, and pens, relentlessly practicing good hand hygiene, and again, requiring everybody to wear masks. Our efforts to keep everyone safe include diligently working to get vaccinations to as many people as possible. To date, we've administered just under 12,000 vaccines. We're seeing a slow but steady increase in the number of vaccines we are receiving each week, and we're very thankful to our legislators who've been lobbying on our behalf. We have the ability to administer many more doses if we can get the vaccine. And we hope to, at some point, be able to give the 4,000 a week that we have the ability to provide. We're happy so many people want the vaccine, but we know that the process isn't going as quickly as you would like. We appreciate your patience as we work to get everyone vaccinated during this unprecedented time. We also realize that there are some of you who are worried about getting the vaccine, but I want to assure you it's safe. I've had it. I can attest to it being safe. You may experience some temporary side effects. In general, they are mild. It's far better to experience those than to actually experience COVID-19. The CDC and FDA have carefully studied the vaccine, actually all these vaccines. No significant safety concerns have been identified during clinical trials, and the vaccines have been held to the same safety standards as other vaccines. They've clearly been proven safe and effective. Now I'd like to turn it over to my colleague, pediatrician Dr. Gretchen Karstens, who has some important messages to share on why you should not put off your annual wellness exams.
Thank you, Dr. Van Deelen. We all want normalcy, and we all want to be able to go out and do the things we enjoy. When you've been staying home for this long, for a year, the thought of going out and doing something normal, like visiting your doctor, that can feel intimidating. And it's completely understandable. But as Dr. Van Deelen has just mentioned, all of us are taking numerous steps to ensure your and everyone's safety. Our offices are among the safest places you can go. I want to see your kids for their well visits. I want to see their smiling faces and hear the concerns that you've been holding close to your heart. We want to make sure that everything is on track for them. It's just as important that you go and get your annual mammography, colonoscopy, and physical exam so that you are in good health to take care of those precious children we all enjoy. Delaying an annual exam might not seem like a bad thing right now, but getting in to see your doctor is important. You may feel fine, but screenings are meant as a safety check that you can help to prevent cancer or catch cancer or heart conditions before it's too late to do anything about it. I was recently on call, and as I was on call talking with families who had health concerns about their children, they also talked about their concern about coming in for care. What we were able to come to conclusions about was that delaying the care, not being seen, was only going to lead to worse outcomes for their child or a more difficult road ahead for healing. And with notification about the different safety facts that we go through to keep you safe, the parents were reassured and were willing to bring their child in for care, where he was able to be treated and returned home. Your doctors and all of us here are ready to keep caring for you in an environment where you are protected from COVID-19. Please don't hesitate to get the care you need. We're here and ready for you. Thank you very much. I'd like to turn it over to Dr. Andrea Boland from Essentia Health's Emergency Department.
Thank you, everybody. Thanks, Dr. Van Deelen, Dr. Pryor, Dr. Karstens. Hi. My name is Dr. Andy Beeland. I'm an emergency medicine doctor, like she said, over at Essentia. So today I'd like to share with you an update from the front lines. And as well, I'd like to share with you a message of gratitude and of hope. The first thing I want to say is that at this point, looking back in time, it's very clear now that our region experienced a COVID surge in November and in December. When we saw that ominous surge begin to threaten our ability to function normally just before Thanksgiving, we let you know about it. And we asked you to redouble your masking and distancing efforts. We asked you to make really difficult choices about holiday plans. I want to let you know that your masking, your distancing, and your sacrifices have made such an incredibly important difference. I'm so incredibly grateful that we're here today in this position to tell you that because of your hard work and your sacrifices, at this point, we in Northland hospitals are doing very much better in terms of COVID. You've just heard about that, 95% down. That's amazing. So thank you so much for helping us to get to this place in our hospitals. I do have an important word of caution, however, similar to the others who have spoken just now. The thing that I've been noticing is that the patients we've been seeing in our emergency department lately are in general sicker than they used to be. It seems that we in the emergency department are seeing patients later in their disease course than we used to. This trend makes me concerned that, like others have said, people are avoiding us because of fear, or maybe even out of a concern that we're overrun with COVID and don't want to bother us. So let me say again, we are in a much better place now, and we are ready to give you the excellent care that you deserve. My heart just breaks when I see patients who've waited too long to see us and as a result have worse outcomes than they would have had otherwise. This started to happen last spring when COVID was new and scary, but it's still happening today. Because of patient confidentiality, I don't want to say any specific cases, but at the same time, I want to give you a few examples from my work in the emergency department so you understand what I mean. So one example is that we in the Northland are really lucky to have wonderful interventional cardiologists and interventional neurologists. Their teams can literally open up blocked vessels that supply blood to the heart and to the brain. And these teams can actually prevent ongoing damage during a heart attack. They can even reverse the symptoms of a stroke before the damage becomes permanent. This sort of medicine can feel miraculous. However, these amazing teams cannot prevent damage in the same way when someone comes to the emergency department with several days of chest pain or several days of stroke symptoms. It's much better to come to the ED earlier in situations like these. Like they say, time is heart and time is brain. For a less dramatic but equally life and death recent example, many infections can get better with antibiotics, even in pill form, if these infections are treated early. However, if people wait longer to seek care, we in the emergency department sometimes end up treating life-threatening sepsis in the hospital with IV antibiotics and even life support measures, rather than treating a minor infection at home with pills. Another very sad example that's common recently is that depression is much easier to help earlier on in its course. Tragic outcomes, such as suicide or attempted suicide, can sometimes be avoided by acknowledging and by treating symptoms of depression earlier. For my final example, I've noticed personally that over the past few months in the emergency department, I, as the emergency doctor, have diagnosed more patients than usual with newly discovered advanced metastatic cancer. These cases are gut-wrenching, and they're reminders that preventative care is incredibly important. Preventative measures like mammograms and colonoscopies do save lives. So as a doctor, it's disheartening to know that I could have helped a patient avoid a devastating outcome if only they'd come in to see me or one of my colleagues sooner. So again, I want to say, it is safe to come see us for both preventative care as well as for emergency care. In fact, like the others have said, we're noticing firsthand lately that it's often more dangerous to wait than to come in early. Again, I want to thank our community for all of your support. Please do stay the course. Please continue to wear a mask. Please continue to physically distance. Please continue to wash your hands, and please continue to stay home when you're sick. Perhaps most importantly, please do continue to support one another. These measures are how we got to this point, and they remain incredibly important today. The last thing I'd like to say is that during this moment of breathing room, when COVID numbers are much lower than they were in the fall, and when the threat of COVID variants is still posing more of a theoretical risk than seems to be part of our day-to-day experience here, we have a really amazing opportunity right now to save many lives by vaccinating many people. Please, please do your part with this as well when it's your turn. Thank you so much for helping us get to this happy chapter in the strange COVID journey. We're so grateful.
Thank you, Dr. Beelan. And thank you to all the docs for taking time out this morning from their busy schedules. We will now open it up to reporter questions. Again, for those questions, you can raise your hand and be called on, or you can use a Q&A button at the bottom of your screen in Zoom. We do have a couple that were sent ahead of time. And so until we have one from a reporter, I wanted to ask a question, and this could be for any of the folks on the call here today. We mentioned kind of a similar situation that occurred last spring when folks were maybe a little bit nervous about coming in for care. What was the outcome of that? What was the result? What did hospitals see as a result of some of those delays?
I can maybe jump in on that one. I'm sure others have had a similar experience. So we saw much higher numbers of strokes and heart attacks for sure. And as Dr. Beelan said, more people with infections in more of an advanced stage of the infection. And really spent the balance of the year never really catching up numbers wise. I mean, meaning that even when we hit our COVID surge again, end of October and November and December, that was on top of really a very ill patient population in the hospital with non-COVID related illness. So it's been a really challenging, a challenging year for that reason. And again, just reinforces why it's so important to get in and get your annual exams, have your health screenings performed, so we can treat you earlier.
One other thing that we've noticed in primary care is a significant drop in the rate of vaccination for children. And as our vaccine rates in children decline, especially around vaccines like measles, we run the risk of having pandemics on top of pandemics. This is something that Senator Amy Klobuchar had taken up and was very interested in continuing to promote, and that through the Academy of Pediatrics, we continue to work towards improving our vaccination rates as a state and as a nation. But it does significantly impact our risk for future pandemics if we aren't vaccinating our children.
I'd just like to support both of those comments from Dr. Carsons and Dr. Van Deelen. Back in May and June, the state of Minnesota was perilously low on ICU beds. They were full with patients, and what was really interesting, they weren't COVID patients. I mean, there was a few, but not many. I mean, they were primarily, as Dr. Van Deelen said, stroke and heart attack, heart issues. And that was very alarming. The surge, the issue that we had in November, December, that was COVID patients, as Dr. Van Deelen said, layered on top of just the normal patients. And not, I shouldn't say normal, because they're during this entire time, there's been increased severity of cases that we've seen because, again, this common theme you've been hearing about, people are not coming in for the routine care. So
then when they come in sicker, they stay in the hospital for longer, and so that hurts the capacity of the hospitals, and that was such a problem, especially November, December.
Dan Crocker asks, Dr. Pryor gave the example of how colonoscopies are down 33% at Essentia. And he wonders, has St. Luke's seen a similar decline?
Yep, I don't have those specific numbers, but we've definitely seen a decline in annual visits for primary care and in screening mammography and colonoscopy. We're actively reaching out to our patients who we believe are due to try and remind them that it is safe and that it's really time to get those important screening exams. But yeah, we've seen a very similar drop.
Because of some of those fears last spring into the summer, I think both hospitals talked about an increase in virtual care. And are those offerings still available at both Essentia and St. Luke's? If people want to take that route instead of coming in, is that still an option for patients?
Yes, still an option, both by phone and video. And sometimes it's a good way to start, and then maybe it might need to come in person because there's some things obviously you can't do by telehealth. But I think if there is a silver lining in this terrible pandemic, I think one is that it really advanced the teletechnology in healthcare. And I'm hoping that continues to stay after the pandemic, because especially in rural America, where distance separates many people from their access to healthcare, this is a way to bridge that access and make healthcare more accessible to people. So it remains today, and I hope it remains after the pandemic.
In a primary care setting, I would say that I probably do anywhere from 1 to 3 telehealth visits a day. And that's been a really lovely augmentation, as was mentioned, that it really does help bring people from further away in. It allows me an opportunity to have access to them and them to have access to the care that they need without them having to drive in sometimes from, a couple hours away.
We have another question here, submitted question. And this again is for any of our panelists. Are you seeing people testing positive for COVID once they have been vaccinated?
I know that we have seen those cases. They're very few. I think it's important to remember that the COVID vaccine, like any vaccine, is extremely good, but it's not 100% effective. What it really is very effective at, though, actually all of the vaccines that have been okayed by the FDA, it's very good at preventing critical illness and hospitalization. So I think the few cases that we've seen, those folks have done just fine.
I have a question for Dr. Beeland, and something you said I think really gets to the heart of the dangers involved with delaying care. And I'm wondering if you could elaborate on a line from your remarks. You said time is brain and time is heart. And I'm wondering if you can just explain that a little bit further.
Yeah, so there I'm referring to the fact that in addition to getting preventative care to help prevent, cancer from becoming metastatic and, those sort of tragedies, there are some symptoms that should, I think, cause people to run straight to the emergency department. So if someone thinks they're having a stroke, time is brain, literally. The quicker you get in, the more that our amazing teams can revascularize that brain and, take people from having severe stroke symptoms to better. Sometimes it really is miraculous to see. Similar, if you feel like you're having symptoms that might represent a heart attack, that's the time to come to the emergency department, not to wait or think about it or see how you feel tomorrow. Sooner is much better if you're having an acute heart attack. So I think, just remembering there are some symptoms that we sure hope people recognize in themselves as reasons to come right to the emergency department.
I don't see any other questions either submitted or hands up. But before we go, and maybe we'll we'll buy the reporter some time if they do have any additional questions. But any final thoughts, closing thoughts after we've heard people speak for the past roughly 30 minutes here from our panelists?
I think it's probably true that this is just repetition of what we've all tried to say, but now's the time, I think. If you have a health concern, even if you haven't had your annual wellness visit, now's the time before we all get too busy. And that really is to help prevent any significant illness or I think the other thing I would say is from a COVID standpoint, we're making great progress, between the vaccinations and the continued restrictions and social distancing. We do have to keep it up yet for a while. It doesn't mean that the hospitals and clinics aren't safe. They're totally safe and prepared to care for you, probably better than we ever have been in a year. So get in and get care that you need. And in the meantime, stay protected. And when you get your chance, take any vaccine you can.
I would echo that. I'm not while I may pretend to be a futurist because I think about the future a lot, I'm not a futurist and I can't predict the future. So I don't know what's going to happen. I'm an optimist. I'm hoping that we're through the worst of this pandemic and that we can all see light at the end of the tunnel. There is a lot of concern, however, including from the CDC and their recent messaging of a potential another surge because of all of these variants from Brazil, South Africa, the UK, and most even recently in New York City. And they are scary variants. We don't know everything about them. We think in general, they're more contagious. We think the vaccines are effective against most of them, at least they help prevent serious disease, as Dr. Van Deelen said. So I'm saying on the one hand, continue to avoid large crowds, at least unnecessarily, and continue to wear your mask. But the flip side is that I hope you got from the panel today is, please come in for your health care, because as long as you wear a mask, you're probably going to one of the safest places you could ever go. And on top of that, you're getting your health taken care of. You're getting those preventive measures taken care of. You're getting tuned up for your congestive heart failure, or whatever, chronic disease you have. And so I think that that's what we're really trying to implore you today, is to come in. It's safer than virtually anywhere else you can go, as long as you wear a mask, because we're wearing a mask. We want you to wear it too, and then you're good. And then we'll take care of you. Thank you.
And just when our doctors probably thought they were off the hook, we do have one more question. So this is from Laura Butterbrodt at the News Tribune. Laura asked, you discussed how staff are taking some of those safety precautions, including receiving their COVID vaccine. And Laura wants to know, have any healthcare workers at Essentia or St. Luke's refused the vaccine?
Yes, it is not mandatory at St. Luke's to have your COVID vaccine. We strongly advocate that everyone get their vaccine. We, I think, have vaccinated about 72% of our employees. And that being said, all the other precautions remain in place: universal masking, social distancing, and the strict hand hygiene. So we believe it is safe and effective, and that everybody who has the chance should be vaccinated.
Same at Essentia. I don't know what the exact number is. There are some people. I'm willing to bet most of them haven't seen COVID patients and how they've struggled as an inpatient. Because when you've seen it, you would run to get a vaccine if you were given the opportunity, because it's terrible. And there's a variety of reasons, some religious, some beliefs, and some for potential medical reasons, but it's a relatively small percentage, fortunately.
I've been grateful to see that some of the people who I knew at Essentia who weren't, completely sold on the vaccines initially have come around. And so I think it's not even like a yes, no thing necessarily. Times are changing and people are becoming more comfortable with the vaccine. And I know of many cases of people who said no thank you initially and now are very grateful to have received the vaccine. So I think, keep that in mind too, that times are changing and people are becoming more open to it.
It's a really good point.
I think this is a great example of positive peer pressure. As people have seen how well we have done being vaccinated, or have been part of the conversations of groups in clinics and heard, oh, you're all going, oh, yeah, I'll come. I think it's been a really nice way for us to have some positive peer pressure.
I think that will do it. We don't have any hands raised and no more Q&A notifications here at the bottom. So with that, we will wrap things up. And again, a special thank you to our 4 doctors, Dr. Beelan, Dr. Pryor, Dr. Van Deelen, and Dr. Karstens for joining us here this morning. If any of our reporters have any additional follow-up questions, please reach out to myself or Melissa at St. Luke's. We'll be happy to try and track down some additional information if you need it. And thank you as well for joining us this morning. So thanks everybody and have a great rest of your Tuesday.